There's a very ignored but vital function of your stomach that I want to talk about today. Normally people know the stomach helps you digest protein like meats and things like that, and then it's supposed to turn it into amino acids, which are the building blocks of protein, so then your body can then use that to make body tissue. Another function of the stomach is to help you absorb minerals like iron, calcium, and zinc, and B12. Another function of the stomach is to stimulate the pancreas to release enzymes to help you digest food. And another function is to stimulate the bile production and also your gallbladder to help release the bile to help you start breaking down fats to then extract the fat-soluble vitamins from the food that you eat. But another very important function of the stomach is to kill pathogens. Now, what's a pathogen? A pathogen is not a friendly bacteria, so your stomach is designed to kill pathogens and to prevent foodborne illnesses. And so your stomach has a huge function of immune defense. So what's in a stomach that helps you defend against these pathogens? Number one, it's the hydrochloric acid in both quantity and pH. If you lose the acidity of your stomach acids, okay, so the pH normally should be between 1 and 3, and let's say it goes up higher to 4 or 5 or 6 or even 7, you're not going to have that immune protection because it's the concentration of acid that kills these microbes, as well as the stimulation of certain enzymes that actually dissolve these microbes. But you have other things in your stomach too that can help you, like lactoferrin, which is very, very high in colostrum, which is in milk to help a baby develop their immune system. But lactoferrin also is antibacterial and antifungal. In the stomach, you also have other antibacterial peptides, which are proteins, which help defend against microbes. And so if you have low stomach acids or the pH is not concentrated or strong enough, you start having side effects like infections in the lower part of your gastrointestinal tract. You can have SIBO, small intestinal bacterial overgrowth, in which you have too many bacteria in the wrong place. Normally, you shouldn't have a lot of bacteria in your small intestine. Most of it should be in the large intestine. If it's in the small intestine, you're going to have a lot of problems with bloating, gas, etc. So without enough hydrochloric acid, you can get SIBO, you can get heartburn, you can get acid reflux, GERD, and of course, what's the treatment for that? Antacids, TUMS, PPIs like proton pump inhibitors, baking soda. What does all that do? It lessens the amount of concentrated hydrochloric acid in your stomach. And that leads to a domino effect of then not being able to kill pathogens. And then you end up with more pathogens lower in your gastrointestinal tract. And you have just a whole series of problems. So without enough hydrochloric acid, you get bloating, gas, definitely indigestion, increased risk for allergies, anemia, mineral deficiencies, especially calcium, iron, and zinc. And by the way, a deficiency of zinc can then lead to ulcers, which then you treat with antacids, right? But also H. pylori can cause ulcers, and sometimes they'll treat H. pylori with antacids, which then worsens the whole cycle, creating more ulcers and more need for antacids. So, not good. And also you can end up with a bile deficiency, like I already mentioned, that HCl helps you release and make bile, and if you don't have enough bile, you're not going to have vitamin A, D, E, or K, or omega-3. More problems. You can also end up with enzyme deficiency, so you're not going to have enough enzymes to digest, so you're going to have a lot of problems with digesting food. But anyway, I wanted to create this video to talk about another function of the stomach that a lot of people are not aware of. If you haven't seen my other videos on hydrochloric acid, I put them down below. Check them out. Had some questions about stomach acid and mineral absorption. If apple cider vinegar was the best thing to take if you want to improve mineral absorption. So I wanted to create a video just on this one topic. And yes, it can help you, but I need to explain a couple little points about this. So normally in your stomach, you have a very, very acidic acid called hydrochloric acid. The pH should be between 1 and 3. Now think about it. Neutral is 7. So every number that goes below 7, you go 7, 6, 5, 4, 3, 2, 1, is 10 times is acid. So if we compare 6 to 7, 6 would be 10 times more acid. 5 would be 10 times more acid than 6. So it compounds. So when you get down to these lower numbers, you have a very, very acidic acid. And this is normal. There's three main things that your stomach acid is supposed to do. Number one, it's supposed to help you break down protein, okay? So if you don't have the acid, you can't break down the protein. It starts to putrefy. You get undigested protein. Number two, it helps kill pathogens from invading the body. So if you eat food with some microbes, guess what? That stomach is there to kill off the pathogens. And if you can't kill them off, they can invade the body and you can create all sorts of infections in the colon. It's kind of part of the immune system. And number three, and this is the topic that we're discussing now, it helps mineral absorption. So having the right amount of acid in your stomach can make minerals more bioavailable. If you don't have enough stomach acid, then the absorption of calcium, iron, magnesium, zinc, copper, cobalt, and other minerals won't be as efficient. You also won't have 100% absorption of folic acid, vitamin C, vitamin D, and vitamin A. So basically, we need this strong acid in our stomach to actually absorb these nutrients. As we age, we lose the strength of this acid and we start having deficiencies of these nutrients. So aging is a very common cause of not having enough strong acid in your stomach. Other causes are antacids. If you're taking antacids, or if you have hypothyroidism, or if you have pernicious anemia, which is an autoimmune disease of certain cells in your stomach, or if you have the infection H. pylori, that can do it, or if you had gastric bypass, which is a surgery that can affect the pH of your stomach. Now, there's two conditions. One is achlorhydria, which is zero stomach acid. You have no more stomach acid. And then another condition, hypochlorhydria, which is a deficiency of that strong acid in your stomach. Both of these conditions will affect the absorption of minerals. And this can also create a problem with SIBO, which is a condition where your microbes are growing in the small intestine instead of the large intestine. And this can affect your absorption of nutrients because these microbes are eating your nutrients and starving you of the nutrients. Now, the question is, can apple cider vinegar fix low stomach acid? And the answer is, it can help absorption of food and has a lot of other benefits, but it doesn't necessarily fix hydrochloric acid itself. It will help the absorption, even in the small intestine, of nutrients, and it actually can help to inhibit some of the microbes growing in the small intestine. So it has a lot of benefits, but to build up hydrochloric acid, there's several other nutrients that you're going to need. Number one, you're going to have to find the cause of it. For example, if it's age, well, you can't do anything about that, right? But if you're taking antacids, you might want to find the cause of that, get with your doctor, and see if you can actually reduce that, because the more you're on this, it's going to be very difficult to correct this. This hydrochloric acid is made from chlorides, as in hydrochloric acid, and sodium, and potassium, and zinc, and iodine. So you want to make sure that you have all of these in your diet. Another good remedy to help build this up would be something called betaine hydrochloride. Okay, so the chlorides can actually help build up hydrochloric acid. But apple cider vinegar can help in digestion, but it's not the main thing to correct a low hydrochloric acid situation. So anyway, I just wanted to give you a summary on answering this question. And I've also put some really important videos on hydrochloric acid on this page. Thanks for watching.